Correct. So 80. So age 80 years and above, okay, the dose should be reduced from 5 milligram BD to 2.5 milligram BD. Body weight less than 60 kg and creatinine greater than 133, like at your last type. So age, weight, and creatinine clearance. So the mnemonic to remember this is ABC, ABC of apixaban. So A for age, B for body weight, and C for serum creatinine. Okay, so how many of these criteria does the patient need to meet for the dose to be reduced from 5 milligram BD to 2.5 milligram BD? Two. Okay, so that's why I've got a 2 of 3 rule. So if the patient meets at least two of the following criteria, okay, if the age is over greater than or equal to 80, if the body weight is less than or equal to 60 kg, and if the serum creatinine is greater than 133, then the dose should be reduced if the patient meets two out of these three criteria. Okay, so that's for stroke prophylaxis. Now, what about for the treatment of DVT? If the patient has a DVT, if the patient has an actual DVT, what's the dose? Does anyone know? So DOACS generally can be used for prophylaxis of DVT and it can be used for treatment of DVT. So if the patient has a DVT or pulmonary embolism, what's the dose of apixaban? So Harsha has typed it correctly. 10 milligram twice daily for 7 days, then 5 milligram twice daily. Okay, so for treatment of DVT, the dose of apixaban is 10. So the way to remember this is that for if the patient has an actual DVT, the dose is higher because there's already a clot as opposed to if it's just for prophylaxis or prevention. Okay, so if the patient has an actual deep venous thromboembolism or pulmonary embolism, so we treat with a higher dose. So we start with 10 milligram twice daily, which is higher than the regular 5 milligram twice daily. Okay, so we start with 10 milligram twice daily for 7 days, and then for maintenance, we continue with 5 milligram twice daily. So how long do you reckon the the maintenance dose of 5 milligram twice daily will be for? What will be the duration of treatment if it's a provoked DVT? So if it's a provoked DVT, what will be the duration of treatment? So generally provoked DVT 3 months and unprovoked DVT 6 months. So I hope you've learned the treatment, the dosage regimen for prophylaxis and treatment of apixaban. So now for rivaroxaban, for prophylaxis, okay, for prophylaxis of stroke in patients with non-valvular atrial fibrillation, what's the dose for rivaroxaban? What's the dose of rivaroxaban? For stroke prophylaxis, what's the dose of rivaroxaban? What's the standard dose of rivaroxaban for stroke prophylaxis? Yes, 20 milligram once daily. Okay, 20 milligram once daily. That's the dose of rivaroxaban. So, what criteria would require that the dose is reduced from 20 milligram once daily? What criteria would require that the dose is reduced from 20 milligram once daily? Does anyone know? So it's going to be the kidney function. Okay, so for rivaroxaban, the dose, feel free to check your BNF, okay, while we are having this session. So for rivaroxaban, the dose will be reduced from 20 milligram once daily to 15 milligram once daily. Yes, thank you, Ada, thank you, Joy, and thank you, Ife. From 20 milligram once daily to 15 milligram once daily if the creatinine clearance is between 15 to 45 ml per minute. Okay, so for rivaroxaban, the only criteria is the renal function, and that's why I've got R for renal. Remember we said ABC for apixaban. Okay, for apixaban we said ABC, age, body weight, and creatinine, serum creatinine. For rivaroxaban is basically just the kidney function. Okay, so 20 milligram once daily reduced to 15 milligram once daily. So for the 15 milligram once daily, is that taken after food as well, or is it on an empty stomach? The 15 milligram of rivaroxaban, it's taken after food. Yes. So both 15 milligram and 20 milligram of rivaroxaban should be taken after food. So when it comes to treatment of DVT now, what do you reckon would be the dose? What's the dose of rivaroxaban for treatment of DVT? What's the dose of rivaroxaban for treatment of DVT? So the daily dose would be higher now because the patient actually has a DVT. So meaning said 15 milligram twice daily, okay? Followed by 20 milligram once daily. Yeah, so we'll start with a higher dose. Okay, for rivaroxaban 15 milligram twice daily. How long for? For how many days? For 21 days. Yeah, so 15 milligram twice daily for 21 days, then 20 milligram once daily. So that's the dose of rivaroxaban for treatment of DVT and pulmonary embolism. Now we've got four major examples of DOACS. We've got rivaroxaban, edoxaban, apixaban, and dabigatran. Which of them needs to be taken? Which of them has a standard twice daily dosing? Which of the DOACS should be given twice daily? Apixaban, right? Apixaban should be given twice daily. Okay, so that's a way to remember. Remember, we said standard dose of apixaban is 5 milligram twice daily. Dabigatran as well. Dabigatran should also be given twice daily. So apixaban and dabigatran are always twice daily. So that's another way to remember. So when you get the question in the exams, you look out for the options. If it's a twice daily dose, then that's more likely to be the answer. Okay, so which of the DOACs would require parenteral anticoagulation before the DOAC is administered for treatment of DVT? So two of the DOACs actually requires parenteral anticoagulation. Which of them? So Joy said dabigatran and edoxaban. Okay. Rihanna said edoxaban and dabigatran. That's correct. So generally, dabigatran and edoxaban would require parenteral anticoagulation for the first how many days? How are we going to give parenteral anticoagulation for? 5 days. Yes, thank you, Presh. So generally for dabigatran and edoxaban, we need 5 days of parenteral anticoagulation first to give the medication time to kick in. Okay. While for rivaroxaban and edoxaban, you can see we've discussed rivaroxaban and edoxaban. There isn't any mention of the need for parenteral anticoagulation. And the way I remember this is RA for rapid. So they have a rapid onset of action. So they do not require parenteral anticoagulation for rivaroxaban and apixaban, RA for rapid. All right, so we're going to move to the next one now, which is edoxaban. So what's the standard dose of edoxaban? What's the standard dose of edoxaban? What's the standard dose of edoxaban? Yes, so the standard dose of edoxaban is 60 milligram once daily. Edoxaban actually comes as two strengths. It comes as a 30 milligram strength and a 60 milligram strength. So the standard dose of edoxaban is 60 milligram once daily. However, for edoxaban, some patients would require dose reduction. Can you think of any factor that will require dose reduction for edoxaban? From what weight do we consider dose reduction for edoxaban? So generally, if the weight is 61 kg and above, then we can give the standard dose. Okay, if the weight is 61 kg and above, then the standard dose is fine. However, if the weight is 60 kg, okay, if the weight is 60 kg and below, from less than or equal to 60 kg, then the dose should be reduced from 60 milligram once daily to 30 milligram once daily. Okay, so that's one factor for edoxaban. Aside the weight, what other factors? So I'm just going to quickly go to my notes so you can see the mnemonic I've used. So creatinine clearance, okay, so weight, creatinine clearance, and one more. What's the last factor? What's the last factor that would require dose reduction? The drug, okay, the patient is on some certain medications. So how many of these criteria does the patient need to meet? So for apixaban, we said 2 out of 3. For edoxaban, how many? If the patient meets how many of these criteria? 1. Thank you, Joy. So the patient only needs to meet at least one of these criteria. So if the weight is less than or equal to 60 kg, if the patient's renal function is reduced to 15 to 50 ml per minute, and if the patient is on certain medications, okay, cyclosporine, dronedarone, erythromycin, and ketoconazole, these are P-glycoprotein inhibitors. So the mnemonic is CDEC. CDEC, C for cyclosporine, D for dronedarone, E for erythromycin, and K for ketoconazole. Okay, so RBD, renal, body weight, and drug interaction. So if the patient meets any one of these criteria, then the dose should be reduced from 60 milligram once daily to 30 milligram once daily. So for patients who will be started on edoxaban, they require parenteral anticoagulation for 5 days first for the treatment of DVT. Is that true or false? For patients who would be started on edoxaban for treatment of DVT, they require parenteral anticoagulation for 5 days first. Is that true or false? That's true. Remember we said for edoxaban and dabigatran, okay, they require parenteral anticoagulation. So the mnemonic for the drug interaction with edoxaban is CDEC, CDEK, C for cyclosporine, D for dronedarone, E for erythromycin, and K for ketoconazole. So Mojidat has typed that already for you on the chat box. All right. So parenteral anticoagulation for 5 days. What kind of parenteral anticoagulation do you think we can use for treatment of DVT as a bridging therapy? Okay, pressure, low molecular weight heparin. Yes, low molecular weight heparin can be used. So finally, we've got dabigatran. What's the standard dose of dabigatran? What's the standard dose of dabigatran? 150 milligram. Okay, is that once daily or 150 milligram twice daily? That's the standard dose of dabigatran. 150 milligram twice daily. Okay. So for dabigatran, if the patient meets some certain criteria, then the dose should be reduced from 150 milligram to what? To 110 milligram. Thank you, Casey. Thank you, Treasure. Thank you, Presh. So for dabigatran, the dose should be reduced from 150 milligram BD to 110 milligram BD if the patient meets some criteria. So can you list any criteria you can remember? What factors would require that the dose is reduced from 150 milligram to 110 milligram? The age is 80 and above. Thank you, George. Okay, if the patient is 80 and above, okay, and that applies to apixaban as well. So Casey said if the patient is on verapamil, thank you. Minnie said verapamil, okay. And finally, if the creatinine clearance is between 30 to 50. Okay, so the standard dose of 150 milligram twice daily. The dose should be reduced to 110 milligram BD if the patient is if the patient meets at least one of the following criteria: age, renal impairments, and dabigatran and verapamil. The dose should be reduced. Okay, I've got a mnemonic for you: B red. So B for bleeding risk, R for renal impairments, E for elderly patients, and D for drug interactions. So for treatment of DVT and PE, parenteral anticoagulation for 5 days first, then 150 milligram twice daily. So the aim was just to help you to quickly revise doses of anticoagulants. Okay, I'm going to post the link to the quiz now so everyone can attempt it.